Good day, my name is Mr Landman. I'm a PCDT pharmacist. I'm situated on the East Rand, town of Brakpan. We are situated in the CBD. I've been involved in PCDT since 2013 when I qualified. The whole idea came to us after we met a healthcare practitioner that was qualified in PCDT. The PCDT pharmacist is a primary care drug therapy pharmacist, so we are falling in the same category as primary healthcare clinics. Just to state that we are not doctors. A lot of people see us as doctors. We are not doctors. We are primary healthcare practitioners. In our primary healthcare course, we covered quite a lot of disease conditions, but according to our scope of practice, we can only treat certain conditions. We have people from different areas. We have people from informal settlements. We have foreign nationals. We have the local citizens of our town. A lot of people that we serve do not have medical aid. So I think this is a passion for us. We want to help the people that are earning enough money to afford our services, but do not earn enough to qualify for a medical aid. I think this is where we've positioned ourselves in this service. And the response is overwhelming if you see how many people make use of our clinic, especially in the primary healthcare setting. A lot of people will, for instance, have a work, but they don't have time to go and spend time waiting at a clinic. So they'll come to us where they can walk in, get the service, walk out and pay for it. So that is the group of people, the citizens that we have earmarked to give the service to. We have two legs to stand on. We are pharmacists and we are primary healthcare practitioners. So if you bring those two together, you have a wonderful product. What we need to look at is when you are thinking of this service and to render the service, obviously you have to do the PCDT training, which is quite extensive, and it puts you in another bracket regarding your knowledge of how to approach a customer. I have many times had a customer, when I'm working on the pharmacy side, coming to us and say, I have quite a lot of pain in this side of my body. And instead of just prescribing a painkiller, I will bring the person into the clinic room and say, can I do 1 or 2 tests on you? To find out that that person actually has a urinary tract infection, for instance, and that we can treat it. Where she would have had to taken a pain tablet and would have walked around and eventually gone to seek help elsewhere. So I think the value of us as pharmacists and the value that we can add out there to the public is enormous. What has been quite a valuable asset in our situation was that we provide services to people from all areas, and our services that we do is basically in 2 parts. My wife, the other PCDT pharmacist, will deal with most of our immunizations. She also sees sick patients, and then myself will do most of the family planning services and then also primary healthcare services. After we completed the PCDT training with the Northwest University, we registered with the Department of Health and obtained a permit from the Department of Health that is registered with the Pharmacy Council. So that is when we started practicing and seeing the value in being a PCDT pharmacist. With our frustration with the other program that we had, we met a lady by the name of Renee Murray, which eventually set up the Alpha Clin pharmacies. Renee Murray made a very valuable observation, and that is that the Allegra, a simple program, is very good in reporting. Initially, when we did the training on the Allegra program, it was divided into 2 parts. The one was the ClinicPro, which we use in our pharmacy. The wonderful thing about Allegra is that we can also generate a prescription. So our record keeping works very well. Where we have an ICD-10 code on the prescription, we have a condition, we have the medication that we as PCDT pharmacists prescribe, so that will go into our script book. The other part of the ClinicPro, of course, is that we can keep the record of the amount of patients that we see and the services that we can print out. At that specific time, when we did the training with Allegra, they also had a wellness section. And there we have the value of doing the vitality discovery testing, which brings in money for us as well. It's another money spinner for our pharmacy. I know in a lot of the corporates that features quite a lot in their pharmacies. With us it does not, because we concentrate more on the PCDT side of the business. The wonderful thing that Allegra did as well is they also included a virtual doctor consultation, which we also use in parts of our business. Although us being primary care health care practitioners, we don't use that all the time. We use it some of the times in our business where it is appointed to be. We've been here now since 2013 giving the service, and in that time there is some situations that we've come across that made our day valuable for us, and when we go home we know that we've made a difference in our community. One day we had a youngster, I call him a youngster, he was about 24 years old, arriving at our pharmacy, lying on the chairs in a lot of pain. Christine, my wife, saw that, and she said to me, we need to give attention to this young man. We took him into the other clinic room and we did an examination on him, found him to be suffering from an acute abdomen. Specifically, we thought that he had quite a severe infection in his appendix. So we phoned the ambulance to come and take him to the hospital. In the meantime, Christine made a hot water bottle, helped him with pain relief, talked to him. The ambulance fetched the youngster, and that afternoon still they operated on him and performed the operation to remove his appendix. The young man visited us a week later, bringing a bunch of flowers to us, saying thank you for saving his life. So those are the challenges that we see in our practice. We also had foreign nationals arriving with children that is burned on fire at the informal settlement. They will arrive here on a Monday, the child is burned on a Saturday. When we said to the mother, why didn't you go and seek help? She said, look, I don't have papers. And categorically, I do help everybody. I don't mind if you have papers or not papers. You're here, you're a sick person, that's what we do. So we help the mother, we bandage the child, but it's a sad affair that we see people coming to us that are not feeling comfortable to visit the original healthcare facilities. And I think this is what makes our work for us valuable, is the fact that we can add value to people out there. Myself and my wife they contracted COVID in 2020. Christine was very, very sick. We thought we were going to lose her. And after that, I think it just became very important for me to spend time with her and also to exercise and keep fit. And we started that time after she recovered, training 3 times a week. We train in our garage, doing fitness training, body weight training and that. And the difference that it makes to us in our daily work is phenomenal. So I have a lot of other passions. I love fishing, but unfortunately my job don't allow me to do that much anymore. But the other things, we are involved in our church. We are both involved in the church in the sense of Christine runs the worship group. I'm part of her group, and ministries that we do. We are also involved in prison ministry, being involved in a group last year, November. Christine is getting involved in another group this year, and we find that prison ministry for us, witnessing to people out there that really has lost everything in life, that's why we are there. Like I said, what is your purpose in life? What do you see as your purpose? And that is to make a difference.